Some lawmakers support drug testing welfare recipients. Others back them to make sure public dollars aren't supporting drug habits, or say it's about money. Grotham, 2014. But who suffers? The ones that benefit from the services. According to Welfare Programs 2015, the purpose of TANF program is to allow income into the home so that children and elderly and other dependents can be cared for. We need to be putting the money that are designating for drug testing into treatment centers so that the people on drugs that are getting assistance can get the help they need and potentially get off of welfare. More than a dozen states have approved the welfare drug testing programs of some sort or another since 2010, but according to the National State Conference Legislature, the proposals keep popping up even though the results suggest that most of the people applying for benefits don't test positive for drugs. Delaney, 2015. As most states turn to drug testing for welfare recipients, we have learned that it isn't successful, and supporting drug treatment is better spent. Drug testing will be discussed as to how ineffective it is for people receiving state aid and how different changes can be a better offer for drug testing. We need to encourage lawmakers to invest the dollars and grant money into drug treatment centers versus drug testing. We also need to support the counseling for individuals who need the rehab can get it. Did you know that 35.4% of the U.S. population receives state aid? Drug testing to receive state aid would most likely increase the poverty level. States tried to keep people from abusing the welfare system by implementing different ways to drug test applicants. According to Martin 2012, Arizona was the first state to impose a testing program in 2009. It began testing new welfare recipients for the reasonable cause. But they had to fill out a paper and answer yes or no if they've done drugs in the last 30 days. Well, there wasn't a penalty if you marked no. Out of 87,000 applicants, one tested positive. The applicants filled out, there wasn't a penalty for lying. Florida requested the applicants pay $30 to $40 for their initial drug test, and if it was negative, they got their money back. But it was also a struggle to come up with that money. So how could they apply for the benefit if they didn't have the $30 or $40 for the drug test to begin with? Though Republican lawmakers in nearly every state have proposed drug testing for recipients of government benefits in recent years, only 12 states have followed through with the testing program with low results. Huffington Post, 2015. Only few have tested positive, and the cost of testing outweighs the benefits. The results from drug testing welfare recipients, let's look at what we've tried and the data that we can get from it. Drug testing welfare recipients is one of those things that sound good at first, but isn't in reality. Presumably, authorities want the drug test to identify people who are using drugs illicitly or suffering from drug abuse. But only 3.6% of welfare recipients satisfy screening criteria for those disorders. Pollack, 2013. And women who reported recent illicit substance use suffer from depression, physical health problems, PTSD, and limited education were actually more common barriers to self-sufficiency and social functioning. Most states have found psychiatric disorders, especially major depression and PTSD, as the highest compared to drug use. States discuss screening and referring individuals to treatment. The welfare applicants and recipients who have a broad range of mental health and substance abuse problems that hinder the transition from welfare to work. Drug testing are good at catching the less addictive drugs, like marijuana. But the harder drugs that are more addictive, they metabolize faster. And then alcohol, that one's not an illegal drug, but it's a highly abused drug. According to Pollock 2013, poorly implemented screenings policies had the potential to flood already stretched child protection and drug treatment systems with more women who didn't need to be there, diverting resources from others in more serious need. Now that we have seen results from other states implementing drug tests for welfare recipients, let's look at the guidelines that are put into place to assist better welfare programs and help everyone that is involved. There are several things that have been put in place to reduce the number of individuals dependent on government assistance. Work initiative requires individuals to work at least 20 hours to receive limited time financial assistance. According to reports, within 3 years of the reform's enactment, millions of Americans had moved from being dependent on welfare to being self-sufficient. For the Tennessees who test positive, their benefits weren't taken away from the kids. They were offered a payee for their children, so their children still received the services, and then they were offered treatment. The use of a protective payee makes it so that the person that needs the benefits still gets the benefits. Budget cuts are forcing drug and alcohol abusers into emergency rooms, courts, welfare systems, which are already operating at a critical mass. Merlana, 2014. Treatment centers are closing all around the United States for lack of funding. And that leaves the addicted individual in poverty with no help. As more states turn to drug treatment to receive welfare, we have learned that it isn't successful and that supporting treatment centers is the way to go. There are several supporters of drug treatment and welfare recipients, as most people have drug treatment for employment. The big picture is that the cost outweighs the benefits, and there needs to be more funding in the treatment center so that people that are addicted can get the help they need. We need to make drug treatment centers more accessible, more talked about, and more of the norm. We need to encourage lawmakers to invest tax dollar grants into drug treatment and counseling so that we can allow individuals who need the rehab the opportunity to have it. Thank you.